Thank you. Good afternoon, good morning, good evening to everybody, wherever you are. Hi, I'm Ruby Nadiri. I'm the Deputy Director of Fair and Just Prosecution, and we are pleased and excited to be moderating this panel discussion today. First of all, I want to give a special shout out and thanks to GLEFA for organizing this incredible conference this past week that we've all been privileged to attend. Fair and Just Prosecution, or FJP, works with elected prosecutors in the United States who are committed to shrinking the criminal justice system. As all of you know who have been attending this conference, promoting harm reduction and bringing a public health lens to matters that have been traditionally left to enforcement and policing is a critical part of that and is essential to figuring out how we can move forward justice and equity in our criminal justice systems. We at FJP are fortunate to work with inspiring leaders like Marilyn Mosby and Sarah George, who are moving and leading this kind of change in the United States. We do plan to leave some time at the end for Q&A, but I also want to encourage everyone to, throughout this panel, to use the chat that you can put in questions and thoughts and keep a virtual dialogue going. In this discussion, we plan to address three main topic areas. First of all, preventing overdoses and the spread of infectious disease. This will include promising strategies for preventing drug-related harms, the ways incarceration can contribute to these harms, and tips for getting other stakeholders on board to support reform. Second, the importance of decriminalization, deflection, and diversion. This will include discussions about model policies from around the world for diverting people away from the system and how several jurisdictions have been able to shrink the size of the system during the pandemic and lessons we can take forward, even as we around the world are able to come out of this pandemic, hopefully. But there are lessons maybe that we can take about how we can improve justice system responses. And finally, how these policies can inform a broader shift in our approach to these issues. And the third issue that we will be addressing is increasing access to treatment. This will include how law enforcement partnerships can expand access to treatment and the importance of doing so given how incarcerations can undermine treatment. And finally, we will be discussing ways in which leaders can work together to advance treatment and help people who have drug disorders try and deal with treatment without affecting or impinging on their autonomy. With that, I'm going to turn over the conversation to Rebecca Blair, who's an FJP Research and Policy Fellow based in Washington, D.C., who will introduce our inspiring panelists and start off the dialogue.
Thanks, Ruby. And thanks everybody for joining us. We have four fantastic panelists today who are all leading aspects of their local law enforcement communities with a strong commitment to reform. So first we have Dan Jones, who is an inspector at the Edmonton Police Service, where he has served for about 20 years. In addition, Dan holds a master's degree in applied criminology from Cambridge University's Fitzwilliam College and is currently working towards a PhD at the University of Huddersfield. Next, we have Marilyn Mosby, who has been the state's attorney for Baltimore City since 2015, when her swearing in made her the youngest chief prosecutor of any major American city. Next, we have Sarah George, the state's attorney of Chittenden County, where she has served since 2017, that is Burlington, Vermont, and she previously served for 6 years as the deputy state's attorney in the same office before she was appointed and then elected to lead. And then finally, in about an hour into the panel, we're going to be joined by Bill Spearin, who is the superintendent of the Vancouver Police Department, where he has served since 1996. He is not able to join us to kick off due to a prior commitment, but we're excited to hear from him a little bit later on. And with that, let's get started with our conversation. So like Ruby said, we are going to begin with a discussion about preventing overdoses and disease spread. And so I'm going to ask Dan to kick us off here by explaining just generally how law enforcement and prosecutors can work together alongside other community partners to prevent overdoses and the spread of infectious disease, and also to point us to any particularly promising models or strategies you've seen in action.
Perfect. Thank you so much. And thank you for putting this panel together. And I'm honored to be on it. I think one of the first things we need to do is, as a collective justice actors, we need to understand who the justice client is. And I think that's one of the biggest failings. We teach the police and our lawyers about the law, but then we expect everyone to manage crime and offending behavior. And we don't actually teach anybody about crime and offending behavior and where that comes from. And when you start looking at things like overdoses, and it's a worldwide pandemic, if you will, it's a public health issue, and we've been trying to solve this as a crime issue for far too long. And when we look at our community members and who we're dealing with and how we can work closer together, we have to work way less siloed. And there also has to be opportunities for handoffs, warm handoffs between policing and community groups. So one of the things that we've seen specifically here is we have a really strong relationship with our supervised consumption services here from a policing perspective. And don't get me wrong, I was on a panel about it yesterday. It didn't start that way. It started to, because there is so much vilification and there is so much stigma around substance use disorder and drug use and overdoses. One of the things that I do think that we are missing the mark on when it comes to preventing overdoses is supervised consumption services are work for a certain population of people who use drugs. We still have people dying alone in their homes. And we're missing the mark on that. And I have to just declare a personal bias. One of my friends that I grew up with died of an overdose on Christmas Day this year. So knowing that and knowing his family and the impact it's had on that, it's where do we find time and how do we work our way into those types of places? And in my opinion, one of the biggest things is we need to stop with vilification and stigma. And we need to be trauma informed and trauma aware. And a lot of people talk about trauma informed, but do we really know what it is? How do we educate our justice actors, both in prosecutions, defense, judges, police, on the real impacts of trauma and the different types of trauma, vicarious trauma, complex trauma, historical trauma, racial trauma. In the Canadian context, our Indigenous population has vicarious trauma and also real trauma that's occurring right now around racism, around over-incarceration, differential law being applied to different people. We need to address all of these things in order to address any of them. And it's a monumental task, but it's a task that's, I think, right now more than ever, I think we've been given opportunity. And I think the opportunity to start looking at things like trauma, the two main pillars of trauma, three of them, but the safety and connections are the place where the police can really have an impact, providing safety and helping people get connected. But we need to educate our members that are at the front line about what that looks like and how to be less traumatic. We need our members to understand that the uniforms that we wear bring trauma with them. Specifically into communities that are BIPOC communities, we bring trauma with us, and we have to find a way to move past that and build those relationships up, and that is on us. And when we partner with community organizations, we have to partner with them all the time. We have a tendency in the policing world to partner with people during crisis, and relationships built in crisis don't last. And it's about us not owning everything. And I think that's the other problem with policing. Policing really likes to be the boss of things. Policing needs to be partnered with things. And those partnerships need to be honest, authentic, and with a lens towards trauma-informed practices and reducing incarceration. So I think that's the start. And one of the things I think from a working perspective that we've seen is working with our supervised consumption services, seeing embedded other things in there, like hepatitis treatment, hepatitis C treatment. We've watched people no longer have hepatitis C because they've gone through the treatments because they've been accessing those services, and building upon those services with HIV, all of the different things that we can do from a harm reduction perspective, be supportive of those things. And when we walk into those rooms in our uniforms or walk into those organizations in our uniforms, we are kind and compassionate. And I think that's a new thing that needs to happen. You look at police badges across the world, integrity, community, courage. I think we need to add compassion into that. And I think that needs to be the way we lead things. So thank you.
Thank you. That was great. And I think that's a great segue into the next part of our conversation, where we're going to turn to State's Attorney Marilyn Mosby. So Marilyn, in 2019, you testified before a panel at the US House of Representatives and said, "There is no better illumination of this country's failed war on drugs than the city of Baltimore, Maryland." And then within that context, since that conversation took place, you've had to deal with a pandemic and a tragic increase in overdose deaths and a whole spate of other law enforcement challenges that have stemmed from that. So can you tell us a little bit about how you and your office have responded to those challenges and what the broader law enforcement community can learn from your experience and your approach?
So first and foremost, thank you for the invitation. And I said that when I did say that there's no better illumination of this country's failed war on drugs in the city of Baltimore, I said that in the context of marijuana legalization, but it applies to drug policy more generally. I mean, when you look at since the era of Nixon and then Reagan, we fought a war on drugs, which was later professed by Nixon's aide, John Ehrlichman, was really a war on Black people. He professed that there were two enemies, the anti-war left and Black people. He quote unquote said, "We knew we couldn't make it illegal to be either against the war or being Black, but by getting the public to associate the hippies with marijuana and the Blacks with heroin and then criminalizing them both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news." Did we know we were lying about the drugs? Of course we did. And that's exactly what they did. In Baltimore, where almost 70% of the city's population is Black, 28% of Baltimore's population lives in poverty, 35% of children live below poverty. There are over 18,000 vacant houses, 16,000 vacant lots. The unemployment rate for young African-American men between the ages of 18 and 24, which is more than twice that of whites. We saw, like my city, communities of color decimated by that approach. And so the targeting and the prosecution, the tough sentences that were imposed mostly on people of color contributed to this cyclical crime driven by the collateral consequences of those convictions. Children lost their parents to the system, and we exacerbated poverty. And most strikingly, we did nothing to reduce drug use. So even before the pandemic, my office was working to end the war on drugs in Baltimore by ending the prosecution of cannabis. We have one of the most progressive prosecution of marijuana policies in the country. We do not prosecute marijuana regardless of weight, regardless of criminal history. And when the pandemic hit, our first priority was really to limit the contact with the system, right? As arrests and incarceration had become exponentially more dangerous for both the individuals involved in the surrounding community. We conferred with public health experts at Johns Hopkins. At the start of the pandemic, we called on the governor to create statewide decarceral guidelines, and we ourselves developed our own decarceral guidelines where we stopped prosecuting drug possession and sex work and low-level crimes that for Black people in this country could lead and often do to a death sentence. You know, and we dismissed more than 1,000 cases, 1,400 cases. We significantly reduced arrests without any discernible increase in crime. And so this experience made clear that many of the traditional sort of law enforcement responses that Dan was just talking about, the default where we've always criminalized individuals with substance use disorder, you know, it showed that there was no sort of correlation to public safety. What we were able to do in the city of Baltimore, and I'm excited, we're going to be announcing this tomorrow, and that our COVID policies are going to be permanent. And the reason why is because we were able to decrease the drug arrests by 80%. We were able to decrease the number of individuals going in and out of the jails by 39%. We were able to decrease the overall jail population by 18%. And despite other municipalities across the country where their violent crime has gone up, our violent crime has gone down. So that correlation where we've been, in essence, criminalizing folks, majority Black folks, Black and brown people in this country for these low-level offenses that have nothing to do with public safety, we can now utilize those resources and divert them into the violent crime and into the more serious offenses, because it's counterproductive. You only have a limited amount of resources. And then last but certainly not least, we as prosecutors we are we're the administrators of the justice system. We should never be complicit in the discriminatory enforcement of laws against poor Black and brown people. And that's what we're no longer doing in the city of Baltimore.
Great, and thanks so much for that. That's really incredible work that you all are doing. And let's go now over to Sarah George in Chittenden County, Vermont. So Sarah, since you took office almost 4 years ago, you have done a lot of work to both implement in your jurisdiction and advocate on the state level for several really forward-thinking harm reduction policies. So tell us a little bit about the policies that you're working to advance, and also what strategies you have found to be effective in getting law enforcement and other stakeholders on board with those policies.
Yeah, thank you. And thank you for having me. I actually would almost want to answer that the other way around to some extent, because one of the ways that I got on board with all of these policies was by talking to the people doing the work, right? I think that a huge part of this problem in general with our criminal legal system is that prosecutors and cops think we know what's best for all of these particular issues, but we don't. Certainly as a lawyer, I don't know public health. I'm not a scientist. I am not a doctor. I'm not a social worker. So going into communities and actually talking with the people at our syringe exchange program, for example, and asking them, like, what do your folks need? What are you seeing your clients struggle with? What are the biggest barriers for them? Talking to doctors that are prescribing buprenorphine and Suboxone, or who are seeing people with substance use disorder, and asking them, what are your patients needing? What is it standing in their way? What's helping? What's hurting? Those are actually the conversations that led to my policies, and to me, frankly, understanding what harm reduction even was, and what that really meant, which ultimately I realized means public safety. Public safety is harm reduction. That is, that they are one and the same, and yet we constantly separate them as if harm reduction is in some way making communities less safe, when it is the exact opposite. So having those conversations in Chittenden County led to my policies to stop prosecuting the possession of buprenorphine and Suboxone specifically. I actually came up with that policy in partnership with the police chief at the time of our biggest city, Burlington, which was super helpful to kind of come into that policy with another law enforcement partner, with a chief of police saying, we will not arrest for this, and a prosecutor saying, we will not prosecute this, because we both understand that this is a life-saving medication that we want in our community. We want people to have it, even if it's diverted, even if it's technically illegal for them to have. We want them to choose that strip of buprenorphine over heroin every day of the week if they have the option. And so we worked with providers to get more people that were able to prescribe buprenorphine and get it quicker. And then we did everything we could to essentially flood our community with it. And our overdoses in that first year were dropped by more than half. So even just a small approach like that, when we really weren't prosecuting a lot of people for it, but it was about the message. It was about letting people in our community who were using drugs know that we cared about them, that we wanted them to live, that we wanted them to recover if they were ready for that. We wanted to be a part of helping them. For that to be coming from law enforcement and prosecutors was a big shift and a big change, and it made a big impact. Further advocating for safe consumption sites, going to Vancouver and seeing their facilities and talking to people about why those are important, why they don't, why more people don't use because of it. It doesn't, kind of trying to destigmatize, like Dan was saying, and talk to people about the realities of it. And, as a prosecutor, I had to go to a lot of those scenes where people were dying because they were using by themselves. They were using alone in hotel rooms or bathrooms or their own homes, and really trying to tell those stories of these human beings in our communities that were suffering. advocating for the opening of a safe consumption site in our area, advocating for more syringe exchange programs, and frankly, more recently, the decriminalization of drugs in general, for all of the reasons that State's Attorney Mosby was just talking about, that this is a failed war on drugs, and we have to start recognizing that we know why they did it, and yet we continue to uphold it. And that's a serious problem going forward for community trust and also for public safety. It does the opposite. So the more that you're having those conversations with not just law enforcement agencies, but the community at a whole, and talking about what the realities of our system are, what we really can and can't do, and how we can do better, it seems to work. We are not super successful. We haven't figured it all out yet, but it's definitely conversations that are happening that were never happening before. And I do think that those conversations coming from prosecutors and law enforcement agents that haven't usually been on that side of the conversation goes a long way.
Absolutely. Thank you for that. And before we move on to the next part of our conversation, I do think that your comments, Sarah, tie in really well with a question that surfaced in the chat for Dan, which centers around this idea that the culture of law enforcement and policing oftentimes encourages officers to take a view that's exclusive of compassion. And so the question is, do you have any advice for engaging officers who adhere to this kind of catch the bad guys view of policing? Yeah, Dan, would love to hear from you on that.
Yeah, absolutely. That's a great question. And the answer is proximity. Proximity breeds care and compassion. What we've failed to do is educate our members on who individuals are. So having lived experience, people come and speak to individuals. We set up a thing in Edmonton called the Compassion Series, which we had 3 different people lived experience from tip to toes, their lives, and how that interacted and impacted them. One of those individuals is a very close friend of mine. Her name, probably shouldn't say her name. Her name's Cynthia. I won't say her last name. Cynthia. She talks about her life, the start of her life, earliest memories were violent sexual victimization by her father. And then working the street as a sex trade worker at 13, survival crime, HIV positive at 15, jail sentence for brutally assaulting and robbing men that were picking her up as a sex trade worker because she hated men. And listening to Cynthia tell the story and seeing the entire story, not a single chapter. We start reading people's books at chapter 7 in the policing world, and we never talk about chapters 1 through 6. And that proximity breeds care and compassion and love. And I truly think we need to do more of that. We failed to do that. We failed our members, and our members think catching the bad guys is the way to do things. Arresting our way out of problems is the way to do things. We know none of that works. We know that that's not solving anything. We know that we need to be more social in our policing, and we need to evolve policing. I'm tired of the word reform. I've heard the word reform since 1991 when I watched Rodney King be brutalized on TV, the first time I ever saw that. And then we can name off name after name after name. George Floyd, we're now still having the same conversations that we had in 1991. It's about evolving the police into a public health world. Pull the police out of justice, pull public health out of medicine. My chief, Dale McPhee, always says, put those together and change the way we do things. And that's how we educate our members.
Great. Yeah, thanks so much for that. Ruby, would you like to take us into the next part of our conversation around decriminalization, deflection, and diversion?
Yes, absolutely. Thank you. So let me first turn to address this question to Sarah and Dan to take, which is specifically how you've seen thinking on issues like decriminalization and deflection shift during the last few years. And what can we learn from what has happened as a result of the reduction in enforcement going forward and decarceration policies during the COVID pandemic? And maybe I'll turn it to Sarah first.
Okay. It's an interesting question because I feel like in some ways it hasn't changed at all in a broader context, and in much more smaller context and local context, it's changed immensely. we recently are talking at this legislative session in Vermont about full decriminalization of all drugs. And it's really fascinating to me to see how many people that are typically pretty, quote unquote, progressive immediately go to that sort of fear place and have these thoughts about it that are really not based in any sort of scientific evidence or data or support. And their immediate response is like, well, how else are they going to get help? We constantly rely on the criminal legal system to supply mental health services and substance use services and expect that we're going to do a good job of that. And when you tell people, yeah, but we don't do a good job at that, it doesn't seem to, it doesn't always connect with people that means something else should be happening. And so in some ways we've come a long way. I think that having a conversation about decriminalization in general is coming a long way. That was not something that was happening 10 years ago when I became a prosecutor, that's for sure. Over time, we've talked about diverting these cases and really focusing on getting people treatment, when the reality is that even diverting these cases is still prosecuting them. You are still criminalizing the behavior, because if they, at least in Vermont, if they don't complete diversion, they get sent back to court. And so regardless of whether you're diverting them or not, you are still criminalizing it. You are still adding stigma to it, and you are still creating fear within the community of people who use drugs, that if they continue to use drugs, they could be arrested, they could be charged, they could go to jail. So personally, I think having a conversation that really, lately I've been saying, if you want to talk about substance use disorders, substance use as a disease and a public health issue, start treating it that way for sure. Like truly start treating it that way, or stop saying it, because it's frankly more harmful when elected officials especially start talking about it being a public health issue, but then testify against legislation that does exactly that. It's more harmful to the communities, and it's certainly more harmful to the people that use drugs, because they see that and then they know that that's how you view them, and that adds to the stigma. So I think that having the conversations is huge, but we really need to hold people accountable to following through with the conversation, because that's the piece that gets lost a lot. We have these conversations all the time. A lot of people say the right things and say that it's is or isn't this, or we need to do these other things. We need to divest from the system and put more into substance use services, for example. But then when the opportunity presents itself, we always fall back on the criminal legal system every time without fail. So actually making those really hard decisions, or bold decisions, I should say, not hard, to actually do it and to actually pass the legislation or divest the funds. I sometimes feels like we're still really far from that, but we just need to keep talking about it and keep lecturing about it.
I want to turn to Dan to offer his thoughts on the same thing. And I think we should all be thinking about Sarah's really good point about how the conversation has possibly moved, in about moving the funded funds and kind of reallocating funds to these services, but how does that actually get done from whether it's a political or policy standpoint? It remains a challenge. And I think we know, all of us, and including, I welcome attendees to, weigh in about what is missing that can help push that forward to actually be reality. So let me turn to Dan first to talk through about what his observations are. And maybe there's been progress in, other jurisdictions that we can also learn from.
I actually agree with Sarah. Can we talk about it and then we get really nervous when it happens? And I'll use the legalization of cannabis in the Canadian context. The fear was exceptional, and even the comments like, well, what if I find someone with 4 plants? Well, I guess you give them a ticket and take the plant away. I don't know. And what we've seen with the legalization of cannabis, in my opinion, is not much. It hasn't, the world didn't end with legalization of cannabis. It really didn't. But what the other thing, when you start to talk about decriminalization, I think we also need to talk about, and I think we need to talk about all kinds of different services. There's this mindset of treatment for substance use disorder that is linear, abstinence-based, all of that. We have to understand that substance use disorder is often a symptom of trauma, and we can't address that symptom unless we address the trauma. And cognitive behavior therapy and is one of those things that's just inaccessible. I had an individual in my research side of my life. She was doing 5 years for armed robbery. At 34 years old, she had no criminal record. She had a horrendous sexual violence history and huge substance use disorder to try to numb her pain. She was on a list for 3 years to get cognitive behavior therapy and found out that in federal prison, you can get it almost instantaneously. She went and got a handgun. She went and robbed a bank. She waited for the police. She then pled guilty and asked for a 5-year sentence and is currently incarcerated in a federal institution in this country getting cognitive behavior therapy. That's not me saying we need to build more prisons. That's me saying we need to understand when we decriminalize and we do these things, that isn't the only thing we have to do, because there are people that are hurting, and we need to stop being like, oftentimes justice is an antacid tablet for pancreatic cancer. It's going to make you feel better, but it ain't fixing anything. And we need to change the way we think.
Thank you. And I want to turn to Marilyn, and I think there's a question in the chat that kind of flows from that observation that Dan made about, I guess the issue is really, one way to frame it is to think about, substance use disorders as one aspect that maybe, you're not going to prosecute possession, but then there are things that flow from having a substance use disorder that you might still, that there is some pressure to do something about, and what is that something? And, by bringing in prosecution or policing into that, we're still not solving the underlying problem. And so, but there is still I guess one could say, maybe call it like, whether it's the public safety concern or people's concern about being victimized by crimes such as larceny, potentially, is something also that you as leaders in your communities have to be thinking about. So how do you think about that? And what is your thinking as both prosecutors and police in terms of how those sort of, I guess, next level crimes or offenses should be handled?
So I think that what we have to understand and recognize is already what Dan has touched upon, is that for far too long, the default position has that we have been relied on police to respond to every social ill of society, right? Whether it's homelessness, mental health, sex work, all of these, substance use disorder, we have this mindset that the way to address it is to lock people up. I would argue that oftentimes that's because it's been people of color and we have lacked the compassion. But now that it's touched, not just the inner cities of America, urban cities in America, it's touched every aspect. We understand, and we are now having that dialogue about it being and needing to be a public health issue. Can't just take us from a law enforcement, prosecutorial, police perspective completely out of the equation. I think because that has been our mindset. We're unlike Europe, right? We don't have a health system that is set up in a way that is going to support folks. The only thing that we've been doing all this time with our war on drugs is criminalizing people. And so I think that it has to be exactly what Sarah said. You have to have bold decisions, and you have to force a dialogue, because people will say, yes, I'm for harm reduction. Yes, we should be treating this as a public health crisis. And then they go and they will testify in opposition into laws that would actually do that, right? And so I think you can use the criminal justice stakeholders to say, no, we're not doing this anymore. And that's what we've done in the city of Baltimore. I know that we've talked about legalization of marijuana for the past 5 years. I know that this is a $1 billion industry that some people are making tons of money, but I'm not criminalizing folks for this anymore. So now let's talk about why. Well, now we have the opportunity. I know that there's disparate sort of enforcement of laws when it comes to drugs and prostitution. We're not prosecuting it anymore. And it forces the hand of the police department to say, okay, well, what are we going to do? We're not going to, if they're going to release individuals without charges, guess what? Does it make sense for us to arrest? No, that's why you see an 80% reduction in arrests. So, okay, so now the community says there's an outcry. Well, what do we do with all of these drug users that are in our community? I mean, how do we address it? Now you force them to say, hey, this should be treated as a public health crisis. You agree. And if you agree, then the police should not be responding. And so now you have to bring those partners and those stakeholders outside the criminal justice system with the criminal justice system to say, guess what? We're now going to respond in the way that we should be. And we need the health department. We need the mayor. We need, these advocacy organizations to provide the services that are needed, because these are still, as Sarah has said, concerns that need to be addressed for those with the substance use disorder, and concerns for the community that for default, they just think that you're supposed to incarcerate. And so I'm excited because we'll be doing just that, partnering with the police department, the mayor's office, and advocacy organizations, Baltimore City Crisis Intervention, to provide 24-hour crisis response teams that are going to provide the services that are going to get to the root causes as to why, and the trauma as to why this is their substance use in the first place. And so I think now especially is really a time for us to, we talked about it during the uprising this past summer. It's time to reimagine policing in this country. It's time to really take it to the next level and not just default to what we've always done, which is to criminalize people for drug use.
Thank you. That's great. That's really fascinating. And one thing I'd like to just I'd like to circle back to that a little bit more to you, Marilyn, about how you actually have been able to do that. But first, I want to just turn it, see if Sarah or Dan has any thoughts on this question of, enforcement related to the fallout, the sort of, I don't know if the collateral crimes are not, they're not collateral, but they're kind of like the after effect crimes that are committed and do raise, I think, can raise public safety concerns. And what do you do about that?
Yeah, I'll just go quickly. I think, like most things, it depends. If the crime that they're committing is, trespassing at a grocery store repeatedly, or going to a place that they're not supposed to go, or maybe a disorderly conduct on the street because of the behavior that it leads to, I don't have any interest in prosecuting those types of cases. I don't have the resources or really the answer to what to do with those types of cases. That being said, if somebody is really suffering from substance use disorder and is robbing banks, or is holding a gun to somebody's head at an ATM to steal money to get more drugs, of course those crimes are going to continue. Speaking for myself, those crimes are going to continue to be prosecuted, but that doesn't mean that you don't still address the underlying issue. That always still has to be a part of it, because if it isn't, at some point that person is going to get out of jail and they're going to be in the same exact position. That trauma is still going to be there. That issue is still going to be there. So addressing it as a public health issue is still necessary, but you do also, from my perspective, have to address the accountability aspect of the harm caused, that even if it was related to their substance use disorder, they caused harm to somebody else, and that needs to be accounted for. That's very different than somebody possessing drugs. If we talk about it in the same way, if we talked about it in the same way as alcohol, imagine prosecuting people for possessing alcohol. We tried prohibition with that, also didn't work, realized we could make a lot more money out of it and it would actually be safer if we legalized it. People still commit crimes every day, horrific crimes, because of alcohol use. And we prosecute those, right? We prosecute DUIs and we prosecute people who might do other things because of their alcohol use, and we address the alcohol use. There are ways to do both, and we've done it with alcohol because we can make money off alcohol, and frankly, because we all drink, right? And so we found it more not all of us, but most of us drink alcohol. And so we found it more accepting, frankly. And because a lot of us don't use heroin, we other it, and we find ways to further criminalize it and to stigmatize it.
Yeah, I think that's a really interesting comparison to how we treat alcohol. I mean, it's kind of on both fronts in terms of also, alcohol does cause all these similar after effect problems, but we don't consider alcohol to be inherently problematic. So it's a great way to think about how we should be rethinking. And so many people have started to do that, but I don't know that it's really permeated our policies. So Dan, do you have any other thoughts on that?
Yeah, so if you're not familiar with Edmonton, Edmonton brought in a chief of police about 2 years ago, a little over 2 years ago. So recent discourse around policing. And his name's Dale McPhee. And what he brought in was he set up what's called Community Safety and Wellbeing Bureau, which has offender management branch, but it also has social policing division. My brother happens to be the superintendent in charge of social policing division. And what we've done there is we've hired navigators through one of our social agencies. And those social workers work with a police officer in a partnership called the help teams. And they literally go out to try to address exactly what you're talking about. The, loitering or these almost not really crimes, but little disorder things that occur. And oftentimes with our homeless population, which isn't always people who use drugs, but it's individuals who are either precariously housed, and it's building that warm handoff. It's working really in partnership. We are together. Their vehicles actually don't look like police vehicles, but they say help on them. And they go out and we're building upon that in a way to try to address these things. And we have, over the last year in COVID, and COVID's weird because there's so many variables, we've seen a reduction in our calls for service. We've seen a reduction in our crime. There's certain things like intimate partner violence and child abuse that have increased. And we're currently working on different evidence-based ways to try to address those things. But as we move through this, we are starting to see things done differently. And one of the words that Chief McPhee uses all the time is off-ramping. The criminal legal system or the criminal justice system is not where these people need to be. This is not the solution. It's never been the solution. We know that. We are literally the definition of insanity. We keep doing the same thing over and over again and expecting a different result. And to Sarah's point about alcohol, I use this comparison when people argue about supervised consumption sites, and I've used it lots. Every single time I walk into a bar and have a drink, I'm in a supervised consumption site. But for some reason, and it's way less medical, because if you've been in supervised consumption sites, they are very medical and they're very clean and they're not dark and dingy like some of the bars I tend to go to. But having that understanding that we really need to change the way we think about things. And I thought that was a great point, Sarah.
I want to turn back to something I think that both Marilyn and Dan have talked a little bit about being able to actually, at least it sounds like, successfully mobilize your stakeholders. Marilyn, you alluded to being able to at least starting to get your mayor and your police chief and the community groups around the idea of reallocating funding. And I'm curious really about how did that happen? And what is it that you found to be most effective or useful in starting that change and actually getting those policies in place? And Dan, I think you also referred to it sounds like there's a similar change going on in Edmonton. And I think that, kind of thinking through how actually practically these things get done is really helpful.
So I think the way that we started it is that we forced it, right? I mean, we made a decision and we basically said, okay, I've worked with 5 police commissioners in 5 years, 4 mayors. And so one of the things that I said is that we're not doing this. So you may decide that you're going to continue to arrest people, but we'll release them without charges. The now commissioner that I've been working with, we have stability in the police department in my city finally. He right away, the day after I made the announcement, basically said to his officers, we're going to use our discretion. We're going to stop arresting individuals for these offenses, right? And so what COVID allowed us to do, right, was to actually receive data. And that is so incredibly important because now we can show that what the world did not end, right? And crime actually went down, not as a result of my policies, but as a result of there being stability within the police department. And what we have always defaulted to and what we always thought was the solution really is not the solution. And so I think the data, I think forcing people's hands, I know that I got resistance from, the bench who they're losing the funding. They were losing the funding for the drug treatment court. And I'm like, sorry, I don't know what to tell you. We're not prosecuting it, right? Then we have treatment facility pressure where they're now saying that they're going bankrupt because we're not prosecuting drug possession. Sorry, you built your business model off the backs of people with substance use disorder, but not happening, right? And so at the end of the day, it's making, as Sarah stated, those bold decisions to do it, forcing a dialogue and forcing your colleagues and the stakeholders within this paradigm to the table using the data.
So I want to just ask you just a little bit a follow-up question on that, on the data and how was that used and how did you use research to help kind of, I guess, make your argument and sort of push the policies?
So it's, I mean, we made the policy. We had I would say it was a blessing that we had COVID, right? Where we could actually implement it and there wasn't a whole lot of resistance. It wasn't a doomsday, oh my gosh, the world is going to end, because we were so focused on the pandemic in and of itself, right? So that has allowed us for the past year to be able to collect data. And what we've seen, as I stated, is other municipalities, major municipalities across the country, their violent crime has gone up, our violent crime has gone down. And even when we've, quashed and eliminated 1,400 warrants, called on the governor to, create a decarceral guidelines and depopulate the prisons, it led to over 2,000 individuals getting released, right? We set our own criteria where we reduced the drug arrest by 80%, people going in and out by 37%. And it's like, at the end of the day, when you have that type of data, you can't deny the fact that all this time we thought that this had to do with public safety. All this time we thought that this was the solution to these issues. And what the data tells us is what we were wrong. We got it wrong. And maybe it is time for us to reimagine policing. Maybe it is time for us to really think about this approach from a public health lens and harm reduction perspective. And I think that's how we've been able to get buy-in from the community. And that's ultimately what we will be announcing tomorrow.
Congratulations. That's amazing. Yeah. I think that's really exciting. And Dan, I just sort of following up on that. Can you talk a little bit more, expand on how research and research insights from things going on around the world can help advance this and what you've learned from that?
Yeah, absolutely. I think, and part of it is, we have a chief of police who was involved in law enforcement public health before he was a chief of police in this organization. So he came here with the idea that, hey, this is the direction we need to go. So having that coming from a leadership perspective, and then also he had something that a lot of, I think is missing in a lot of police agencies is the desire for evidence-based practices. There's a lot of best practices out there where that means that I'm the police chief in so-and-so area and I call the chief in so-and-so area, or I'm a police officer here and I go, hey, what are you guys doing about this? Oh, we're doing this. Perfect, let's do it. And then we think that's going to work because someone else is doing it. We don't do a lot of outcome measurement when it comes to policing. So we have an actual area in our organization now that is evaluative, looking at outcomes, research led. Oftentimes, my area in the research area, we will pull up literature and go through what evidence-based practices look like. We're currently in the middle of, I talked about the help teams. We're looking at using the help teams. We're going to be doing cohort analysis to determine outcomes for the individuals that the help teams kind of adopt, if you will. And then we're going to match that cohort with people that we just don't have enough people to actually take the 435 people that we can identify are in that top 1%, we can take about 80. So if we match cohort and then we follow that for a year and we look at the outcomes for those people in a human-centered design way, we can determine if we're doing the things right, and we can iterate if we're not. Another thing that we're doing is we're looking at how do we do this spatially. Take the help teams, we are identifying our high harm or high crime areas. We are taking those hotspots, and then we're going to try the intervention with a help team, and we're going to try the intervention with policing as usual in the Cooper curve mentality, which is the 15-minute intervals. Doing that with, actually, we're working with Professor Chris Copetti at George Mason University, and he's going to be our academic lead on that research. So it's literally about targeting, testing, and tracking, as Larry Sherman from Cambridge would say, and we need to continuously do that. For far too long, policing has done things and just kept doing them. Things like scared straight programs that are still occurring in North America, we know create undue harm, and the individuals who go through scared straight programs are more likely to end up incarcerated than people that don't go through them. Why do we do it? Because it seemed like a good idea at the time, and we fail to look at the outcomes and measure them. And that's where data research becomes super important. And that's where we've seen this organization go. And it's, to me, it's an exciting world in policing right now.
That's great. And I know, Sarah, you have also talked about how important data has been to support the changes that you've been able to push. And I think I've heard you echo something that Dan talked about how people who, I think, like there are a lot of people who have been in the profession of prosecution, for example, and or policing, and say, yeah, I do this because this is the way it's always been done. And they have been doing it for years in the same way. And how have you been able to use data and research to kind of combat that just kind of instinctive, this is the way things have always been done?
Yeah, I mean, that's literally the story of my life, is talking with people in law enforcement who have been in law enforcement for over 30 years. And frankly, kind of going back to what Marilyn was saying, in order to to kind of change the direction of policing or prosecution, you have to admit that you've been doing it wrong. And that's really hard for a lot of people. And especially because I truly think that a lot of people in law enforcement get into it for the right reasons and thought they were doing the right thing. But when constantly confronted with evidence to the contrary, ignore it because it requires them to admit that they've been a part of the problem and that they have been a part of the harm. They have added to the harm. And so as a prosecutor, I think that one way of talking about that to people is immediately owning that reality, that I am a prosecutor and prosecutors are a part of the problem. My discretion as a prosecutor has been the cause of a lot of this harm, but we can also be the solution. We have the discretion and the power to actually change the way that we do things. And trying to empower that same discretion to do the opposite of what we've been doing for so long really does go a long way with law enforcement, but it's getting over that initial hump of just, come on, just own this. We messed up. We've been messing up for a long time. Data can do that, because if you are just telling somebody you're doing it wrong, you're doing it wrong, you're doing it wrong, it's really hard to accept. If you say, these are the numbers, these are the outcomes, and especially if it's done by a third party, or you have third parties or outside parties that are the ones, especially research organizations at colleges, for example, or through other universities that don't have a sort of bias in it. That, especially in my opinion, goes a very long way, because you don't control the narrative. Luckily, the narrative is almost always going to support what you're talking about and what you're trying to do. So you can hopefully rely on that third party to come to the same conclusion that you have. But putting that in people's faces is so much harder to avoid. And don't get me wrong, some still do and will continue to do that. But it is much harder when you look at the numbers and start to realize, like, okay, and then even if they don't ever admit they've been doing it wrong, I have found will just slowly stop resisting quite as much. And that's frankly just as, that's fine. I think just not getting in the way, not being a roadblock is in some sense is as much as we can expect, and need to take advantage of that even.
I just want to add, it was Johns Hopkins who did the data analysis for us
Yeah.
throughout the past year.
So it seems like these academic partnerships are really incredible. And I mean, it makes sense because a lot of these agencies aren't necessarily going to have really built out in-house research and data capacity. Right. So I do want to turn it over to Rebecca to sort of take what we've been talking a little bit about, what we know about research and what we've learned to sort of move it forward into thinking also about how we can help people. Not just, kind of thinking about what we shouldn't be doing, but maybe thinking more broadly about how we can use this to help people. But I do want to also just remind all of the attendees that we really welcome, and we've welcomed the questions that we've had so far that have really enriched our conversation, and welcome you to continue to put in questions and thoughts in the chat. So Rebecca, let me turn it over to you.
Yeah, thanks, Ruby. So this last section of the panel before we move to Q&A, like Ruby said, is focusing on how we can increase access to treatment. And I think it makes sense to start the conversation by kind of understanding how the legacy approach to enforcement sometimes gets in the way of those goals, and how different jurisdictions are changing that approach to advance treatment. So I'm going to ask Marilyn to start us off on this one by explaining, first of all, how incarceration cuts off access to treatment, and also how your office has worked to improve access to quality care for people who need it.
So I think one of the things that we have to recognize is that incarceration often exacerbates the factors, like when it comes to like mental health challenges, unaddressed trauma that Dan was talking about earlier, and poverty, right? Like that I was referencing. That leads people to drug use in the first place. That's a big reason why, weeks after someone's struggling with substance use disorder, they're released from prison, they feature the highest risk of overdose, right? We also know that the threat of incarceration serves as a major sort of deterrent for people considering treatment. And so what we've done is we've worked to increase access to treatment through programs that we've initiated in my office, like implementing what is called Aim to Be More. They go through first-time felony drug offenders. They go through a probationary period where they learn life skills, job training skills. They do community service. And at the end of that probationary period, they're given a job. Felony records are wiped clean. We've created a policy and legislative affairs division, which has advocated for policy change in the legislature. We advocated for safe injection sites and, ensuring that, we have we just got it passed. I just got word yesterday that the decriminalization of drug paraphernalia, going down and championing some of these, issues that we should really be treating like a public health issue. We ended, as I stated before, the prosecution of cannabis, breaking down a major sort of barrier that keeps people from seeking help. Rebuilding trust in law enforcement, including reinstituting our office's community liaison division, hiring new community liaisons in every one of our districts throughout the city, and increasing the grant funding by more than 28%. It's important that prosecutors not only affect the change in their own sort of office, but they advocate for that systemic policy change.
Yeah, thanks so much. And I'd love to hear from Sarah kind of on a similar point. So I know a lot of your work in Vermont has centered on breaking down barriers to treatment. So how do you think that law enforcement or other system actors can play a role in both bringing more people to treatment and in enhancing the quality of treatment?
Yeah, I mean, I would certainly echo everything that Marilyn just said. I think that the more we cut off access to treatment, the less people are going to get treatment whenever they're ready. And I also think that the more we expect the right kind of treatment and the right kind of recovery will also add to the same stigma, and less people are going to be likely to get treatment because they might think that full sobriety is the only right way, and they're not ready for that, especially if there's underlying trauma that's not being addressed. They are not going to go there. So advocating again for harm reduction, for, we're working with police all the time to have Narcan on them at all times, to have fentanyl test strips available to people all over the place. I mean, we are trying to flood our community with fentanyl test strips in bathrooms, in everywhere that we used to, during the AIDS epidemic, we had condoms everywhere. We had available resources for people that we are not doing now. We have in Burlington, we have a syringe exchange program that's incredible, but even around the rest of Vermont, that's not necessarily the case. And advocating for the use of those things, and understanding that people who are using fentanyl test strips, for example, may make a different decision about how much heroin they use, or how much, now fentanyl's in people's cocaine, testing more drugs and making sure that they know what a safe amount for them is public safety. That is a part of our job, to make sure that people who are using drugs are safe and are alive to eventually, hopefully, recover. By, like Marilyn said, forcing that by just saying, I'm not going to prosecute these cases, forces law enforcement to figure out another way. And when law enforcement's forced to figure out a way, law enforcement will ask community, or we ask the community, to figure out another way, to step up. That conversation led to talking to doctors about getting more doctors with the ability to prescribe buprenorphine, for example. That was not happening. We did not have many doctors in our area that could prescribe it. So it's a significant amount of extra training. The hurdles that even doctors have to go through to prescribe buprenorphine is telling. It's just another way that we have essentially made people getting this treatment harder. But having those conversations to say, this is your lane and you need to step up. You need to get more doctors that can prescribe this medication, so that this medication is in our communities, so that people can get treatment when they need it. Having a wait list that's months long is absolutely unacceptable. If people want treatment, they should be able to get it immediately. Advocating for those things as a prosecutor, when that conversation is not usually what's happening from this office, is incredibly important, and it goes a long way.
Thanks so much, Sarah. So Dan, a lot of your research has focused on the victim-offender overlap and the legacy of trauma in crime. So I'm curious how those findings translate to discussions of treatment. So given what we know about how the offender pool and the victim pool often overlap, and about how trauma influences crime, what should that tell us about the way we approach treatment? Should it tell us that any of our historic approaches to treatment are misguided? Can it help us construct more effective treatment programs?
Yeah, thank you for that question. I could literally talk about this for 4 days, so I appreciate that. So the research that I've conducted, and it's been in partnership with the University of Alberta Prison Project, and also from Cambridge and from Huddersfield, we've interviewed over 800 people, incarcerated men and women, in both federal and provincial prison settings. In the Canadian context, a federal prison is a prison for 2 years plus a day. Provincial jails are 2 years less a day, and also remands. So in interviewing those folks, and this is where I totally agree with data being absolutely important, but it's not just quantitative data. So I sometimes discuss and argue with my mentor, Larry Sherman, because he's very much quant related. I think we need to make sure that we include the qualitative data and the voices of those involved. So when we start to look at this from a practical perspective, 96% of women and 95% of men incarcerated in these facilities experience victimization and trauma. About 84% of women and 83% of men experience that victimization and trauma prior to their first detected offense, at average about age of 9.9 years old. And when I say trauma, when I'm speaking of this, I'm talking about violence and sexual violence. And in fact, in one of our women's prisons that was federal, 100% of our women experienced sexual violence and violent victimization prior to their first detected offense. So we start to think about this. I think we can start to think about this differently. So when we start talking about health, I have kind of brought it towards the universal precautions concept. If you are a first aider, you're taught in first aid universal precautions, PPE, wear your gloves, wear your mask. 0.06% of the Canadian population has HIV. 0.6% of the Canadian population has hepatitis C, and 2.17% of the Canadian population is currently testing positive for COVID. But we tell you to wear these everywhere you go. 96% of our incarcerated people have suffered trauma. What is that? What does that tell us? What are we doing wrong? And I agree, people don't want to admit that we did things wrong before. People wanted to think that we have done things right the whole time. What we've done is the war on drugs was a war on people who have experienced untold trauma. Our current policies and how we interact in the justice system as justice actors, we are incarcerating trauma. Now, in no way do I excuse behavior. We talked about earlier, I think it was Sarah that said something about people robbing banks. Of course, they have to be addressed. And the other thing that I will say, of the 800 people that we interviewed, not one of them blamed their trauma. It wasn't used as an excuse. It wasn't like, this happened to me, so this happened. It was actually the other way around, because as the system, in the system, what we've done is we've told them they're bad. We've told them that they're bad people. So you get the, I did the crime, I'll do the time, I deserved what happened to me. I wouldn't have investigated for me either. And somehow they're conflating the fact that as a child, they were sexually assaulted multiple times. They don't deserve the police's response because of what they've done now. So to me, it's about where do we intervene? How do we intervene? And what do we do? Incarcerated settings are not places. I worked in both federal and provincial prison. They are not places that you're going to heal. They are not places that you're going to very often experience a change, unless for whatever reason you've decided to make that change. And I have become very, very close friends with people that I've put in jail, and they speak with me and they do things in some of my classes, and they lecture on, and they don't talk about prison as saving them. They talk about being in prison. There were some potential benefits for them, but why do we have to wait till we lock people up before they get those contextual benefits? Why can't we set up different systems? And this is where we need to start holding our other partners into account as well. Social agencies can't stop working at 4 o'clock in the afternoon. It's not helpful. And then we say to the police, well, you need to offer them. You need to, we tell our members, well, we're dealing with people with trauma. We're dealing with people, we need to be compassionate. And the member goes, well, what do I do with them? What do I do with them? And we need to break down those barriers in the systems. We had an individual in Edmonton who, and Edmonton, if you're not familiar with Edmonton, weather range in the summer from 30 above Celsius to 30 below Celsius. So that's our weather range over the course of a year. So sometimes you're really hot, and in the wintertime, it can be really cold. We had an individual who, substance use disorder, mental health crisis often, was walking backwards because his toes were going to fall off because of frostbite and gangrene. The only people that advocated for him were the police officers in my division at the time. They unfortunately had to arrest him on a drunk in a public place so they could argue with Alberta Health Services to get him into treatment and stop releasing him after you do a surgery, and make sure his wound care is managed until he's healed, because of his substance use disorder and because of his mental health crisis that he often found himself in, was going to die if that didn't happen. We have an amazing organization, an amazing group at the Royal Alexandra Hospital, led by Catherine Dong, Dr. Catherine Dong, and Dr. Janetta Salvagiato, and it's an ARCH program. And they actually, they manage opioid and other substance use disorders inside the hospital so that people get the proper service that they need. And again, 80% of the people in there are actually alcohol, which is something I think that people need to be realize. But we need to look at how we interact, when we interact, and there has to be some different accountability measures as well in the funds that are going to community agencies, and they have to be outcome based as well. And that's a wholesale change, right? Because as has been brought up often, the police are always the default. And if it's 3 o'clock in the morning or midnight on a Saturday and no one's working, the police will be the default. And if we don't give the police options to do something different, or at least we might tell them to do something different, but if there's nothing different for them to do, then nothing different is going to happen. So I think we take those experiences of our incarcerated folks, and one of the things they scream for is proper treatment, not just abstinence-based treatment that we think they need. Let's talk to them about those individuals, what they need. let's meet people where they need to be. There's always that the concept of the golden rule: treat people as you want to be treated. The platinum rule: treat people as they need to be treated. And that's where we need to get to, and that's how we're going to change the game.
Yeah, that's great. So just building off of that last point that you made, and this is actually we just had Bill Spearn join us. Welcome, Bill. So maybe we'll turn it over to him in a minute, but to give him a minute to get settled. But kind of a question for anybody who's interested. Per your point, Dan, about meeting people where they are and giving them what they need, a lot of times efforts to increase access to treatment in the justice system in some ways echo traditional enforcement approaches like drug courts or treatment as a condition of supervised release or etc. So I'm curious to get your thoughts on how we should kind of approach those programs, given what we've learned from Dan and others about the victim offender overlap and the role of trauma, and how we can approach treatment in a way that also shrinks the size of the system and avoids the harms of coercive pressures on people who aren't ready for abstinence or for a wholesale approach. Bill, just since you just joined us, do you want to hop in here?
Hi, sorry, better late than never.
Glad to have you with us. So we were just kind of talking about how the justice system can increase access to treatment, and in particular, how it can do so in a way that shrinks the size of the system, meets people who are struggling with substance use where they are, and avoids coercive pressures. Do you have any thoughts on that?
Yeah, I mean, I guess my experience in Vancouver is we've always tried to have that connection within the courts itself, because I think that's something we've been missing is, you know, kind of almost like we call them overdose outreach workers in Vancouver. And what we were trying to do before the pandemic hit was to get somebody within the court system itself. And we actually managed to get one of these workers in our Vancouver Police Jail to link people to the assistance that they need, to the services they need, that sort of thing. So, I mean, I believe that if we don't have these type of people in the courts, in the jails, in places where they are going to, you know, come into contact with law enforcement, then we're missing an opportunity.
Yeah, super helpful. And I think since we weren't able to bring you into the conversation when we talked about kind of stopping the spread of infectious disease and overdose deaths, I think it also fits into this conversation. You've done a lot of really innovative work in Vancouver to advocate for things like safe injection sites and drug checking sites, which really kind of are the gold standard for treatment that meets drug users where they are and doesn't demand abstinence in exchange for treatment. Would love to hear just about your experience navigating skepticism of those programs and how you were able to bring those to fruition, and also how it's changing the community and how it's changing law enforcement.
I guess, you know, I'll start by saying that this happened such a long time ago that I honestly don't remember how it was presented to us at the time, you know, in Vancouver. I can say that I am part of a shrinking demographic within my own police department that has seen Vancouver pre and post harm reduction. Most of our members now don't know of Vancouver without these services, and they walk right past them because, frankly, we have bigger issues in Vancouver. I would say that I was able to navigate this and accept it because I saw Vancouver pre and post. I got to see what Vancouver was like without these services. I got to see the spread of disease, bloodborne diseases like HIV and hepatitis. It was a bad situation here, you know, in the late 90s. And I went away for a while I was away doing some other work with the police. I came back to the downtown east side and there were all these services, and it was almost immediate to me that I didn't spend my whole shift going from overdose to overdose. And I think that's when I started to, that was part of my whole acceptance of this issue, that, we can't arrest our way out of this. And I had to come to the realization myself that this is a healthcare issue. It's not a law enforcement issue. Drug use disorders, drug addiction, however you want to frame that, it's a healthcare issue. And I think that's the first step for police to learn. And once you accept that, then it's much easier for you to take this journey into, how are we going to solve this? Not just by ourselves, but collectively with all our partners that include prosecutors, people who use drugs, members of the community, and other groups like healthcare, of course.
Yeah, great. So to all of the attendees, we're going to be moving into the question and answer portion. So would encourage everybody to put questions in the chat if you have them, or you can use the Q&A function. We would love to hear from you. But as we kind of give folks a little bit of time to work on that, did any of the other panelists want to weigh in on that question surrounding increasing access to treatment while avoiding some of the harms of a traditional law enforcement approach that's coercive and doesn't meet drug users where they are, more makes sure they get to where the system is?
If I may, I wouldn't mind taking a stab at that.
Please.
One of the things that I find challenging is the usage of the justice system for treatment. And I sit on a couple of committees that are looking at what are appropriate conditions. One of them, I think, is a massively inappropriate condition is to stop using drugs. Because just because you have a condition from a judge that says you need to stop using drugs, your opioid use disorder or your substance use disorder doesn't go away. And I think it's irresponsible from a systems perspective to set people up to fail so we can throw them back in a carceral setting and have that revolving door of breaches. When we breach people, we actually interrupt all kinds of things. And I'm not saying that we never breach people, but I'm saying that if you breach people for things like a no alcohol condition, a no substance use condition, conditions that shouldn't be there, and then they go to jail for a short period of time between, and most remands in the Canadian context are between 1 and 14 days. And in 14 days, you can lose a lot. You can lose your supports, you can lose your a partner, you can lose a living space, and then you can come out into even worse situation that you were in before because you were given a condition that was unattainable for you to succeed on. And I think sometimes in this, and I'll go back to the original, when I was walking a beat, I thought this was a great way to manage things. I thought I'm going to save my beat because I can go throw this person in jail because I know they have these conditions and I know they're going to be drinking tonight and they're inevitably going to commit more crime. So if I do that, I'm going to make it a safer city. When the research now shows, and now the older me and less thin me realizes that this is an absolutely tragic way to use these conditions, and we're using them to set people up to fail. And before we started and we were kind of in the pre-conference, I talked about an incident that occurred in Edmonton where we had a woman who had committed a murder in the 90s. She had been out working and in the community for almost 10 years. She made a decision to go to a bar. She had 3 drinks and she went home with an individual. When she went home with that individual's partner later came, pulled a knife on her. She ended up pulling their kid into a bathroom to make sure the kid was safe. She called 911 from her phone. She left the house prior to police arrival. When the police got there, they asked her name. They ran her name. They saw she was a murderer with conditions. They arrested her last March. She'd been incarcerated since last March. She's lost her job. She's lost her home, and she's lost all of her property because the landlord threw it all out. And in a conversation with her, what is the justice served there? What did we serve? We put someone back in jail who'd been contributing to society for 10 years because of a no alcohol condition. And when I talked to her about this, she's an Indigenous woman. She said, I don't have an alcohol problem. I've been trying to get that condition removed for a very long time. She felt that they wouldn't remove the condition because she's Indigenous. And that is brutal. And it's not a single story. And it's one of those things where we need to really, right now, we have to be in the courts because that's where people are. But how about we try to make it so individuals don't need to go through the courts to access treatment? How about we make it so treatment beds are available for individuals in the community at a much higher rate? And how about we make it so the type of treatment that they can get is their choice? like I said, we could go abstinence-based treatment and still not deal with the root cause. 12-step programs still don't deal with the root cause. We need to address the root cause that's causing the symptomatic drug use. And we need to, as justice actors all together, the defense, Crown, DAs, the judges, the police, we need to make those bold decisions, and we need to make those bold statements, and we need to hold our other partners accountable, and we need to build up that community treatment stuff. My opinion.
Thanks so much. And Marilyn, did you have something to add on this point?
The only thing I would add is I would agree with both Sarah and Dan. I think, you know, from my perspective, one of the things that we got resistance at first because of the funding drug treatment court when we said we were not going to prosecute mere possession of drugs. But I think what we did do, and that forces them to kind of think about it from a different sort of perspective. What we did do are for those offenses that Sarah talked about earlier, where you're harming other individuals, right? How can we approach it so that we are getting to what Dan just talked about, those root causes? And so why is this person, you know, assaulting another person? Do they have an underlying drug issue? And so one of the things that we've talked about doing, and we have actually implemented, is expanding what was once in drug treatment court unacceptable, like violent acts and individual like crimes that are associated with harms imposed upon people. We have now included that in drug treatment court so that we can get to the underlying issues, and also being quite bold in saying, no, if it's mere possession, we're not going to prosecute. You don't have that luxury of allowing them to go through drug treatment court. We're not going to use a criminal justice system for that, but we will use a criminal justice system for harms that are imposed upon people, but also ensuring that we're getting to those root causes of trauma and substance use disorder.
Yeah, absolutely. And Sarah, I think you had a couple thoughts.
Yeah, I would echo everything that Marilyn just said. That's exactly the sort of shift that we made in Chittenden County. And instead of our treatment court, frankly, being a little bit of a joke, not only to law enforcement, but really as a deputy state's attorney, I didn't really trust it. I didn't think that it was really making the difference that I felt like it should be. And so I wasn't as likely to send cases there. Over time, having only kind of possession cases or low level violent offenses, if that's, you know, if that makes sense, to actually now having some of our most serious cases in our treatment court has shifted the entire conversation with law enforcement about why those cases are going there. And our treatment court team has really stepped up and have come to understand the importance of having those most serious cases in it. Because again, the data and research shows that those are actually the cases that are most successful in treatment court. And I know that there are a lot of issues with treatment court, and most, like you said, Rebecca, the idea that people are being forced. When we first got into COVID, we were really worried about our treatment court participants because we knew we weren't going to send them, we weren't going to sanction them, right? In the same way, we weren't going to send them to jail for a night if that might get them COVID. You know, that was a decision we were not going to do. The participants knew that that wasn't going to happen. And so there was a fear that suddenly they weren't going to participate, they weren't going to engage, or they weren't going to have, you know, go forward with their treatment if they didn't have a sanction. It turns out that's not true, right? Like some people fell off because they didn't have access to virtual means, they didn't have cell phones, or they couldn't appear virtually. But for the most part, once people are engaged in treatment and feel like they have a supportive system, it doesn't matter if there's a punitive response when they maybe have a positive test or they aren't doing as well. And our treatment court understood that. And so I think going forward, some of that might actually stick. Like you don't always have to have a punitive response to somebody who has a positive test. Maybe you just need to have a conversation with them about why that happened, what's going on with them. Can we help in another way? Are you food insecure? Are you housing insecure? Did you lose your job? Are those things we can help you with so that you don't have that same fall? And if you do, you need to tell us, you need to come to us, we can help you. It's all about the conversation that you start having with people. And I know that there's issues with treatment court, but I do think prosecutors can do a lot of work to to help with that, and to change that conversation. It just depends on whether or not they're willing to, send much more serious cases so that the whole team can kind of step up.
That's great. So there's an interesting question in the chat about the impact, something that we've talked about a little bit, alluded to, about the harmful impact that incarceration actually has on people, and actually causes more harm. And I want to just sort of take a sort of a broader lens and talk a little bit here, if you guys have thoughts about how, like, a lot of what you've talked about is important, is partnership with community organizations. And yet we have a history of mistrust in a lot of communities of policing and prosecutors. And so, there's a history of mistrust and also kind of the endemic racial disparities that have underlied all of that. So how have you found, and have you found it a challenge to actually get trust from community organizations to partner or to be kind of resources? And if you have, how have you addressed that in terms of just the way that all of that we've talked about has already caused so much harm? And how do you get that trust, and how have you been able to build that trust? And I'd open up to anybody who wants to respond to that. Sarah.
I'll just say really briefly that we say this all the time, but actions speak louder than words. And when you start just implementing policies and doing the work in the way that these organizations have been preaching, they come to you a lot of time to say, I want to partner with you. Are there ways we can help? This is our bread and butter. How do we work with you to make this happen? And they just naturally come. If you're just sort of talking the talk and you're out there saying certain things and they come to you and you don't do it, they're going to stop trusting you, and they're not going to work with you. So not just saying we want to work with these community partners, but when those community partners come to you and tell you what they need, you do it. You listen to them and you follow their lead, and then you rely on them going forward. I think that much too big of an issue is the idea of saying, I want to work with all of these community partners. I want to treat this as a public health issue. And then when public health agencies come to you to partner and you don't, you're doing more harm than good. So I think that's a really important aspect of it. And I would just, to touch on the question directly, in Vermont, one, I think it was lost on a lot of people how much drug use was occurring in our jails. And as part of our conversation around buprenorphine and the sort of quote unquote legalization of buprenorphine, we actually passed legislation that mandated medically assisted treatment in our jails. And with that, and not just while they're incarcerated, but a kind of warm handoff when they're released to a clinic that will provide them that medically assisted treatment after. And our overdose rates dropped dramatically, and our incarceration drug use dropped dramatically because people stopped bringing in illegal substances if they were actually able to just get the medicine they needed while they were in jail.
And who was it that was behind that effort? Was that your office?
Actually, I mean, it was the Department of Corrections was behind it because they didn't want the illegal drug use in their jails, right? And because people were getting out of jail, and like Marilyn said earlier, were using at the dose they used before they went in, and they were dying. And they were still in DOC custody a lot of times, just community custody. And that came back on them. And so they actually were a huge advocate for it. They were certainly concerned a little bit about the diversion of it within their jails. But frankly, again, I'm okay with that. If that's what's being diverted within our jails, that means we need more of it, not less of it. And it certainly, if it's going to impact the amount of illicit drugs coming in really unsafe ways, I will take a buprenorphine strip any day of the week. And I think that most people in our system understood that. It actually went through pretty smoothly, considering.
That's great. And so I'm curious, Marilyn, if you have any thoughts about how the trust in your community, because I know your community has had a lot of problems with, particularly with the police and in Baltimore. And I'm curious about how you have found, how you have been able to build trust with your community organizations to partner with them.
I mean, I think, as I stated before, we've had some issues in Baltimore in the past few years. Everything from the uprising following Freddie Gray, the death of Freddie Gray, to the body-worn cameras where officers were reenacting discovery and seizure of evidence, not placing a statement of probable cause, to the 163-page Department of Justice report that exposed a pattern in discriminatory policing of communities of color for decades, to having to work with 5 police commissioners and 4 mayors. We've having to play cleanup for one of the largest police corruption scandals in the history of the country, where we had rogue police officers planting guns and drugs on citizens and then redistributing the drugs on the streets of Baltimore. I think the way that we've attempted to ensure trust through all of that is to actually have one standard, apply one standard of justice, right, to all, regardless of race, sex, religion, and occupation. We've prosecuted over 33 officers since Freddie Gray and convicted them. We've, advocated for police accountability reform nationally, locally, statewide. We've advocated for breaking the school to prison pipeline, and we have a number of youth initiatives where we touch more than 7,000 young people through our programs. We've been consistent, in the communities, and I talked about this a little bit earlier, where we have community liaisons that are assigned to every sort of police district in the city of Baltimore, that are not just the face of the office into the community, but the voice of the office back to the community. We've secured funding, more than $7 million. That figure is off, but we've secured a great deal of money, Victims of Crime Act funding, that has allowed us to double the size of the victim witness our victim witness unit. We now have victim witness advocates in every single one of our every single one of our units in the state's attorney's office. We renovated the victim witness waiting room into a therapeutic space. So everything from the color of the wall to the green wall to the color of the floor is how to ensure that people that have gone through trauma are much more inclined to be in a space in which that in and of itself is anxiety provoking, having to walk the halls with defendants and their friends as they await for their cases to be called. So, I mean, I think it has been a multitude of things that we've attempted to do. We just started a victim witness campaign where we have an anonymous tip line, and we're in essence asking folks to provide us information. We have a Court Watch app that we ask people to download onto their phone so that they can follow cases. So it's not just one thing that you can do in a situation like that, especially with all of the challenges that my city has been presented with. But I think that being consistent and being that stability when there's been a great deal of instability has helped us a great deal. I mean, and we don't measure by any means, our success is not measured by our conviction rate, but it is telling that, despite all of those challenges that I talked about earlier, we still have an overall felony conviction rate of 93%, homicide rate of 81%, a special victims unit, child abuse cases, domestic violence cases of like 96%. And so that, I think, is telling, because I think that we've been able to some effect, restore the trust, at least from the perspective of my office.
That's great. And I know that we are a little bit over time, actually, but that was a great way to sort of wrap up a lot of what we've talked about building, sort of thinking about trauma and harm reduction in the context of, and also the overlap of victims and witnesses, and how all of this is tied together, and thinking about how we're rethinking policing and enforcement. So I want to thank all of the panelists for your, this is really amazing, fascinating conversation. And I want to thank the attendees, and also definitely special thanks to Th13 for sponsoring this conversation. And I hope you all have a great day or evening or wherever, whatever you are doing. Thank you.